Those who are hint that you people are able to see me clearly. Let me sit there. I'm not sure whether we are live or not. I'm not getting a perfect position. I think this is working. Okay, so many of you are online, and if you are able to hear my voice clearly, just give me some message. Thanks, Naveen, for telling me that you my voice is clear. So those who have joined live, just wanted to tell you that I'm in the nearby the hospital because somebody is admitted. I need to be in the hospital for that moment, so that's why I'm here. And lot of thoughts were coming in my mind. Recently, have been to Munich, and recently have been to Google, and then we are reviewing as the year is ending. Uh, we were. I have ordered some tea so that I can we have a casual discussion with you all. I hope that will be fine. Uh, I don't know why people are leaving earlier. Thank you, thank you, thanks, Naveen. Uh, One more is Mehej. I'm sorry, I'm not able to pronounce him. But the reason why I wanted to have a casual talk with you all and coming live is as the year is ending, 2025 is ending, and recently have been to Google and Europe, and also we went through the McVent course, which is going on recently. We were trying to look out what are the things missing on the channel where we can deliver more useful content in a better way. Discussions. I would not say content, but the lectures or the sessions which we can give you all. So there are two things. Want to explain you two things. Discussion was we want to discuss two things with you all. First, when we analyzed by sitting with the Google, when the team were having reviewing our channel, and we were discussing what is our vision to provide the intensive care education, and then their team analyzed and told us that although we have covered most of the queries which happens in the ICU, if we go to the ICU channel.com, ICU channel on YouTube and search there something, most of the topics are there in the ICU short sort of category, and most of the general queries are answered. Also, there are very good long lectures on mechanical ventilation, antibiotics, bedside rounds, and something like that. But there was a lot of potential in digging deep. Sorry, I got a call in between. So there are long lectures on which there is a lot of potential which you can teach on the channel. Like many of you are requesting sedation in the ICU, digging deep into antibiotics, digging deep into electrolyte imbalances, and one more thing is the real case scenario. That's a challenge because problem is because of the privacy issue these days. It's very difficult to record cases live. But I don't want to be telling you like PPT sort of scenario. That's not something which I want. Uh, I want to teach you like how is it how we are discussing in a raw room in the ICU room. We are having a discussion. We are real time solving the queries like that. So that's the point I wanted to make clear. So this is one area where we need to improve the long lecture. So what I want you people suggest in the comments of the video, or you can send us on academics@esbicm.org that which format of live cases we have discussed in the before, but somehow we have not picked up. the way it should be, how we should offer real time cases, whether we want a PPT case of scenario discussion, or we want just sitting and talking about the scenario, or we want to just simplify one particular challenge with that we faced in that particular case, clinical case, whether we need to do that, or uh, you want you should start from a case and then have a detailed discussion on that particular topic in that scenario. So that's something which is I think we need to have a discussion that how we should come up with that. So, secondly, what we want to tell you is second point of discussion was how we can communicate bilaterally in two-way communication. Now, what is happening is on the ICU channel. No, no, Naveen, ICU shots will be continuing like that. What we want is we want the long lectures also to come up, whether they should be in the form of clinical cases, or whether you want it from starting from theoretical part. It's like suppose SH we want to discuss from starting to the end, or we take a SH case which we presented and then build up on that particular case, or specific complication of that particular SH we need to discuss. But I don't want it to be a PPT style. That's my challenge. I'm not very good at preparing PPTs, and PPTs I sort of don't know how it doesn't make sense to me at times. So that's a challenge. Secondly, so I want something different, either PDF discussion, or just like I'm sitting and explaining the things, either that discussion or a different way which we can do. 5 minutes है ना राम? It's okay. So that's what I want to discuss. How we should take these long lectures. So just comment me and tell me whether you want it still a PPT style, or you want a real case. Just in the ICU, it will become very difficult. I tell you, real case scenario. But whether you want a room discussions like that, or you want to start from a case and then build up a whole theory on that and discuss in that manner, the ICU shots will continue. Second point, which I was again discussing, was want to discuss is the two-way communication. Right now, Naveen posted something on the chat, in the live chat. So I replied, but I'm not able to see his face. I'm not able to hear from him. So we want a solution for that. So we tried Zoom, but there is a limitation for that because 100 participants are limited. If we increase, the cost increases too much. Then we tried Google Meet. Google Meet is somehow doing well. We are using in the McVent course, and it is doing very good. Up to 300 participants are joining every week. That is a good thing. But we want the number to increase. So what is the platform? Discord is something which somebody has suggested. I am figuring out how we can do it in Discord. So just wanted to know that if you have any suggestions, how we can make the communication in the coming year a two-way communication where we can meet bi-weekly, we can have case discussion, we can solve the doubts, we can hear from you, I can see your faces like that. We create a community where with each one of you, not just the people who are subscribed and they are behind the channel. Yes, Naveen. Discord, I am trying because it's very new to me. I thought it is only for gaming people, but today only I have started learning it. I don't know how it's going to help, but any suggestion, or if you have any insights in that, just drop me an email on academics@esbicm.org if you have some suggestions how we can use it. The point is we want a bilateral discussion on the cases, bilateral discussion. We want to create a network where uh, we are familiar with each other. We are not just sitting behind the channel as a somebody who's commenting. I know by their name, the username. We want to interact with the real people. We need to identify the real people. Now, or at the suppose we have 4 or 5 ICUs in our hospitals, and at times when somebody got stuck, they call the other person and have a discussion, and then they figure out what best we can do. Same way. Same way, if somebody has a problem, they can connect with us in the real time that, sir, we are having this problem. If I have something, I can call them and discuss certain states. So this way we want to create good community like that sort of thing. It should be a real time discussion scenario. So how we can do that? Zoom is very very expensive, and even after that there is a limitation of 500 people. Google Meet we are trying also have a 500 people limitation, but still it is very much easy to use and a little bit cheaper than that. But I want it to be more, so, because we have almost 1.85 here, and and uh, it's very easy to use. Discord, yes. I had not even I remain online for a longer period of time, and still I'm not comfortable with the Discord. So I'm not sure how we can use it. But if we have any other options where we can try out, or if we can just try out with a Google Meet bi-weekly classes or bi-weekly discussion, and let's see how this work out. Uh, Hopefully for few, and if the number starts crossing 500 people, then we can think of what we can do next, or simple YouTube live. But in YouTube live, we don't have a two-way discussion. That's my problem. That's what I don't want. That we want a two-way communication. I need to see your faces. I need to communicate with you. I need to learn from you. I need to discuss things with you. So these two things which we are working, we will figure it out in the before the end of this month, December. So that what will happen, uh, first how these long lectures will go, how we'll plan this long lectures specifically, the thing which is very 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 much requested, and we have tried to do it but could not figure it out, the real case scenario discussions. One thing we want, and the second is how we can communicate bilaterally. So these are the two things. If you have any suggestions on this, please let me know. I would be more thankful to you. If you have still somebody has any comments to tell me, I'm here for till my tea is over. Uh, you drop a message. I will be able to reply, or I can have a Q&A sessions like YouTube live. This will be also a good thing. I think we'll try with Google Meet or Discord once I get familiar. Because if I need to get familiar with Discord, I don't know how many people who are who are working intensive care, they are very much comfortable with that. That's the challenge. That's the challenge. We need to have a simple solution for it. By the way, Naveen, you are coming at the a king sort of mark is coming in front of you, showing it. You are one of the top fans of the channel. Okay. So, how about this casual lives? Maybe I just need to tell you a point, and we can just put up here and discuss that. How about this? If we can, I just come for 10 to 15 minutes live every day, and what we are discussing on what we have seen in the ICU, we can do that.